Hello to the School of Public Health community and beyond. Welcome to the Diversity, Equity, and Inclusion Annual Update.
During the first semester of each school year, all schools, colleges, and units across the University of Michigan come together to highlight key community initiatives.
The people you will hear from remind us all of what we have accomplished and where we are going. Thank you for taking a couple of minutes to be with us.
I began pursuing public health to understand all the various aspects that are associated with research, healthcare policy, and medicine. Joining the school-wide Diversity, Equity, and Inclusion Committee is one way I am meeting that pursuit. Joining the DEI Committee has allowed me the opportunity to connect undergraduate students to the DEI initiatives across the school. During our first year, myself and Emily Chang devoted time to learn current activities in each department that would help form undergraduate DEI activities. In this video, you'll get a chance to see a glimpse of some of the exciting DEI actions around our school.
With funding from the Rackham Faculty and Student Allies for Diversity program, doctoral students, faculty, and staff created and launched a new public health case study for the fall HBHE departmental orientation. The case study engaged incoming and returning students as well as staff and faculty in an equity-focused, anti-racist analysis of the 1995 Chicago heatwave. Participants viewed the documentary film, Cooked: Survival by Zip Code, engaged in small group discussion, and heard commentary by community activists and faculty. The session closed with a discussion of continued opportunities to build anti-racist equity-building skills. This health equity case study will serve as a foundation for future anti-racist analysis of public health issues.
In winter 2020, we continued our lunchtime Biostatistics DEI research seminar series, which highlights DEI-based research by students, staff, and faculty. Presentations included a discussion of the census and its challenges, and a study of racial inequities in prostate cancer mortality. We are carrying out a departmental climate survey to better understand the current climate and to guide us in our work. We work together with the newly formed Biostatistics Student DEI Committee. We collaborate with our sister department, Epidemiology, and our jointly shared Student Navigator has started over 13 student interest groups, including a Black, Indigenous, and People of Color group, an International Students group, and a cooking group.
Our committee was formed to focus on student advocacy and priorities. We work to provide a student-only space to discuss DEI issues and behave as a student consulting body for broader departmental DEI work. Our primary goals are to increase recruitment and retention of underrepresented students in biostatistics, to develop a student DEI curriculum component, and to increase students and alumni engagement with DEI work. We are working with the Curriculum Committee to incorporate data related to health inequities in the Applied Statistics coursework, and to develop an elective class focused on topics of inequity in biostatistics research.
In the first half of 2020, the EHS DEI Committee focused on social community building in the form of a cultural cook-off and group discussions on several podcasts regarding race and gender in the workplace. The committee also facilitated skill building through educational training such as power and oppression within social groups and an anti-racism workshop. The National Black Lives Matter protest motivated us to educate ourselves and our department, leading to a DEI-led anti-racism journal club. This monthly event has explored issues such as racism in academia, internalized superiority, and voter suppression. We intend to channel the information gained from these discussions into a new EHS DEI mission statement with an emphasis on environmental justice, as well as into the development of anti-racist actions we can recommend to our department.
During the 2019-2020 year, we began to develop a long-term strategic plan for DEI on our department. We created a survey to better understand faculty, student, and staff priorities in regard to DEI and to identify existing barriers. The results of the survey highlighted the need to integrate DEI principles into every facet of the department. We used the results to develop mission and vision statements to guide our department's future DEI work and use these to propose concrete initiatives. We invite you to learn more about our work on our page on the Heights. The department also launched a new facilitation program with funding from a Rackham Faculty Allies Diversity Grant. 14 students and staff facilitated small group discussions at orientation and hosted a monthly seminar and dialogue series to deepen knowledge and awareness of DEI-related topics.
During the 2019-2020 academic year, the HBHE Diversity, Equity, and Inclusion Committee worked to foster critical analysis of structural inequities and build skills for anti-racist public health practice. In our monthly Let's Talk About discussions, we focus on current events and topics suggested by participants, Over the past year, such topics have included reparations, voting rights, and non-binary inclusion. Nurtured and facilitated by HBHE staff, Let's Talk About sessions are open to anyone in the School of Public Health. We strive to provide an open space for faculty, staff, and students of all departments to discuss and learn from each other about DE&I issues.
I want to start by thanking the department for their commitment to DEI. Last spring, our DEI committee brought together interested students, staff, and faculty. And in partnership with the Residential Masters Committee, we laid the groundwork for an orientation session to instill in incoming students a foundational understanding of race, racism, and public health. In the summer, we translated these plans into concrete details, and we emerged with a 2.5-hour session filled with short lectures, videos, and case discussions on various topics led by faculty, staff, and students in small groups with the first-year students. This was paired with a 2-hour interactive dialogue on racism and public health led by a faculty expert. We as a committee worked hard over the course of several months to meaningfully engage our departmental community in re-envisioning DEI's role in orientation, and we are excited to carry the spirit forward in future orientations and department activities.
After graduate students in the Nutritional Sciences Department shared their concerns about racial injustice with the department, the spring and summer months were devoted to finding shared goals and opportunities to dismantle systemic racism and inequity within our department and the nutrition community as a whole. This largely was accomplished by a collective letter exchange between students and faculty, listening sessions facilitated by school-wide leaders, and a student organization-developed survey on the immediate needs of our current students. We are now working to adapt the strategic plan to address said needs and to formally create a structure to achieve the goals we work together to create. One such goal was to make the DE&I committee more accessible to students, faculty, and staff, and we have now instituted bi-weekly drop-in hours open to all members of the department. The strategic plan will include many components as a result of these collective efforts: anti-racism in teaching, broadening our methods of recruitment, improving the department culture to facilitate retainment of a diverse and supported student body, faculty, and workforce, and dedicating a portion of the department website to DE&I resources and a statement of commitment that are easily accessible for current and prospective students. We plan to introduce the strategic plan to students at a virtual town hall that is scheduled for January of 2021.
We are proud of our school's commitment to diversity, equity, and inclusion. We completed 85 action items across 12 strategic objectives. We hosted 221 workshops with 3,382 participants. 91% of staff and 63% of faculty completed 8 hours of continuing professional education in the 2018 to 2019 data collection period. We created a faculty mentoring policy and modified the governing faculty policy to be more inclusive. And we continue to partner with historically Black colleges and universities to bring brilliant students and create faculty partnerships. We remain committed to diversity, equity, and inclusion.
We hope this video reminds you of what is possible when diverse voices and talents come together. We'll continue to work collaboratively to build a school and a campus that's more equitable, inclusive, and diverse. Our new Year 5 strategic plan is now available for all to read at the website on your screen. Thank you for your time and for your commitment to diversity, equity, and inclusion.